Hey, we've got an interesting discussion for you on the business of oncology. And joining us is Jim Koeller from the University of Texas at Austin. He is a professor there, and he is also at the Health Science Center in San Antonio. Thanks for being with us.
Thank you.
The business of oncology, boy, you've got your work cut out, don't you?
Yes, the business of oncology has truly changed in the last 4 to 5 years. Historically, oncology practice was oncologists having an office. A lot of times their wives were their office managers. They could see patients, run a practice, make a reasonable living, and it was relatively easy to do. Those days are gone. Today, with the new regulations, laws, the Medicare legislation of 2004, reimbursements changed, the world of oncology has been kind of tipped upside down, as we call it, and practices now actually have to start to run and be managed like an actual business, which is hard for a science guy, trying to become a businessman at the same time and still want to take care of patients and treat cancer.
Jim, community practices are really undergoing culture shock, aren't they?
Excellent word. I'm going to have to use that in the future. Culture shock. Yes, they're trying to grasp and hang on to what they know and how they did business, realizing that that's kind of going away, and they really need to change fundamentally. It's almost like a paradigm shift how they do things, and at the same time, their heart is still in patient care, and that's a hard thing for them to adopt to.
What about the issue of reimbursement from both sides, the oncologists and the insurance companies, the payers? They need to stay in business also, or the whole system collapses.
It's an interesting, relationship. The oncologist is kind of like a teenager, where the parent gives your teenager a credit card and a checkbook, and the teenager goes and just spends. At some point, the parents go, listen, I understand you're spending, but that's my money. We need to set some rules. You cannot just spend to infinity. There need to be some rules. That's kind of my example of the payers, the insurers, and the oncologist who writes and cares for and provides resources for patient care and visits, in diagnostic scans, in drug therapy. They're writing the check and using the credit card, but the payer is the one who puts the money to pay for it. And historically, these groups, we want to do things. The oncology world wants to treat. The insurer wants to try and, control that, and it's always been a very love-hate relationship. Everything we want to do, they don't want us to do. It's kind of like having the teenager who wants to go out at night, and you say, well, you can, but you need to come home at 10. So you fight back against the rules of the authority. And that's what we see happening in oncology, although now we're really getting to the point where once you get out of high school and you're in college, you actually start to look back and say, hey, my parents weren't so wrong. They actually weren't as unsmart as I thought they were. Maybe I need to talk to them more. So we're actually seeing a little bit of a switch recently where we're understanding that we need to work together, where the oncologist, yes, does need to treat patients, make a living, but the insurance company also has a job to do in the business to run, and maybe we should work together to the common good of the patient. And those kind of things are just starting to occur, which is real interesting to be caught in the middle of this.
What about the use of pathways?
It's interesting that in the last 3 years, in my 30 plus years of doing this business, I've probably heard the word pathways and guidelines, NCCN guidelines used, probably more than I did in the previous 30 years. So even the community oncologist is beginning to understand pathways, the systematic approach of care, having some rules around how you manage a patient. And I think everyone's understanding that that's probably the direction that the world's moving. The key reason why pathways make sense is it's a tool for resource management. As I said, the payers, the insurers want just some control, some clue that they have some say into the control of what the oncologist is doing. And pathways is one of the easiest tools to achieve that.
You're in the eye of this storm, so to speak. What is your viewpoint on what's coming with new healthcare legislation?
Well, we already had a law that just passed. I think what we're going to see in the future, between now and about 2014-15, a lot of things are going to occur. I think everyone's aware, if you watch the news lately, there's going to be a lot of pressure on the payers who are asking for large increases in what they charge, that the world's going to push back on that. But if the insurers can't charge more, they're going to pay out less. I mean, the money has to come from somewhere to pay for health claims. So I think the medical world, the oncology world, will see even more pressure on them by the payers to control what they do in the next couple of years as we wait for this new healthcare legislation to really take effect and to see what all the rules and regulations are that will drive that. For those that have looked at the legislation, if you really look into it, there are a lot of committees, a lot of groups that are going to be created that will help manage and control the use of healthcare resources, both from the government standpoint and also from the commercial payer standpoint. So you'll see more regulation in how healthcare is done in the future. What that picture looks like, I think we're all waiting to see.
Well, Jim, maybe that new legislation will do what you want and then bring these forces together.
I hope so. I think at the end of the day, everyone wants to see cancer patients being treated by medical oncologists, getting good care, getting optimal care at a reasonable cost that we all can afford, that the oncologist makes a reasonable living, that the insurers stay in business, and then at the end of the day, it's patient-focused care. I mean, I think that's what we all want. How we get there, we'll have to see.
Thanks for joining us.
Thank you.
Appreciate it.
Thank you very much.
Jim Koeller, professor at the University of Texas at Austin and the Health Science Center in San Antonio, Texas.